In the literature, pregnancy has been described as a particularly powerful teachable moment to change health behaviours because women may be especially motivated to improve their health and they have more contact than usual with healthcare professionals. So this means that midwives in particular have the opportunity to discuss healthy eating with pregnant women. And these potential opportunities are important because we know that pregnancy alone for some women is not sufficient to drive behaviour change. However, we also know that midwives face barriers when it comes to discussing healthy eating, such as finding the topic sensitive, not having sufficient training or resources to engage in these conversations, and believing that women are not motivated to change their behaviours during pregnancy. This study aimed to explore midwives' experiences of providing healthy lifestyle information and support to pregnant women during the antenatal period. It also explored what training and resources midwives have been provided to underpin these discussions and to better understand some of the barriers and enable us to engage in pregnant women in a dialogue about healthy pregnancy. The study involved conducting 7 semi-structured interviews with 12 qualified and practicing NHS midwives and 1 student midwife near completion who worked in a community settings. 8 of the midwives were community-based with 4 in a hospital, and experience ranged from 3 months to 31 years. A reflective thematic analysis was conducted to code the data and generate themes, and 4 themes were generated. In summary, where this study adds to the literature is in relation to the continued need for adequate training, resources and guidance regarding gestational weight and healthy eating for midwives. In lieu of this, midwives often relied on their own personal experiences to shape the advice and information they provided to women. Midwives had a good understanding of the challenges women face in managing their weight gain and eating habits during pregnancy, including psychological elements. They also showed empathy towards women, often recounting their own difficulties with weight and eating. Additionally, BMI is the main factor to signpost to interventions. Although there was an acknowledgement by some midwives that BMI is not a good measure of health, it did remain the main factor used to make decisions about who to signpost for additional support.